Hi, my name is Lexi, and I just passed my NBDHE after working with Billy. I really thought I knew what I was doing, but after failing the NBDHE, I knew I had to do something different in regards to knowledge intake and not just memorizing to pass. I'm chronically online and saw Dental Hygiene Basics TikTok before, so while I was searching for NBDHE tutoring, Dental Hygiene Basics came up, and I instantly got in touch with Dana, who introduced me to Billy. She said that Billy would be helpful in dealing with the mental challenges surrounding the exam as well as filling in any knowledge gaps, and boy, was she right. Billy helped me prepare for the NBDHE by breaking down difficult concepts into easy to understand information. She also helped me stay focused on the most important topics. She helped me build my confidence and feel much more prepared going into the exam. Confidence was a big deal for me because I would second guess every answer, and that was one of my biggest downfalls. Billy helped me realize that I know the information and that I need to just trust myself. Billy is incredibly knowledgeable, patient, and supportive. She truly cares about her students' success and takes the time to make sure you understand the material instead of just memorizing it. She has the best tricks to remembering the information. It's the little funny mnemonics that truly help. Also, her podcasts were a dream for someone that is always on the go and needed to listen to something when sitting down and opening a book wasn't an option at the time. Working with her made me feel very comfortable and made studying feel much less overwhelming. And honestly, I would recommend her to anybody that needs a little bit more help with studying and isn't feeling as confident. Thank you, Billy.
Hey everyone, welcome back to the Happy Flosser. This is a podcast that helps dental hygiene students feel confident, prepared, and grounded when they are working with patients. I'm your host, Billy, and today we are going to dive into a really important and honestly overlooked part of patient care, the medical history. I've had several patients recently reach out to me. I'm sorry, students, not patients. Students reach out to me asking about the medical history and asking for support on how do I further question the patient and how do I alter the treatment based on that information. So if you've ever felt unsure about what counts as a red flag or what follow-up questions you should ask when a patient checks a certain box or circles something, however they're doing their intake form. This episode is going to be your new best friend support. So think of this as your mental checklist, the things that should make your internal antenna go up as a provider. All right, so before we jump into specifics, let's just ground ourselves, right? Medical history isn't just paperwork, it's a clinical tool. It's all about, here's the question I want you to be constantly asking yourself when you're reviewing a medical history with a patient. Is this patient safe to treat today? Is their risk level too high for me to adequately provide care without some kind of risk of a medical emergency occurring? So what can you safely do today with your patient? What modifications do you need? Do you need a med consult? Do you need to consult with someone else? Maybe you need just some faculty input and support. Now, whether that patient needs a medical consult, usually those types of things are dictated by your faculty. But if it's something that you're unsure about, always ask. It's all about keeping your patients safe. So my goal for you is to really learn to spot those red flags early so you don't feel like you're reactive, right? You feel more like a clinician who is making informed decisions. Now we're going to talk about really kind of the soup to nuts, just to kind of give you an idea, but there are so many more conditions that you have to be concerned about. I could never cover that in one episode, right? And I got to tell you guys, we tend to start appraising our patient the minute we see them. So that general health and appearance, when you go out to get them in the reception area, you're already looking. Do they have a disability? What is your overall impression of their well-being? Right. And what is the patient's appraisal of their own health? Remember, this is a very subjective thing. And our patients, you can have one patient who has nothing on their medical history. And if you ask the right questions, you can reveal that the only reason why there's nothing on their medical history is because they haven't been to the doctor in 15 years. And that can present some challenges for you as well. So it's important for you to also figure out how the patient perceives their health to be. right? And think about the appointment considerations for that patient based on what you see when you go out to the reception area to get them. What is their response? What is their cooperation? What is their attitude about what they should expect during the visit with you? And those are incredibly important things. So it's important right out of the gate to find out when was their last time they saw their regular doctor, right? What's the date of their most recent exam? The reason why they went? What kind of tests were done, right? Those are the types of things. Do they have any anticipated issues coming up? And if they tell you yes to any of these things, yes, I went to the physician, it's okay for you to say, well, what did you go for? Was it just a routine physical? Were there concerns from that visit? Was it with your doctor? Was it with the PA? Like, who saw you, right? This actually helps you determine if a medical consult is needed. And if those vital signs are being monitored, and that is where you kind of pick up the ball and take those vitals and add to that body of knowledge, right? You're developing a baseline with your patient. And sometimes you're updating depending on what type of patient you're seeing, if you're seeing a new patient, right? So some of those follow-up questions are important for you. Any recent changes in your health or medications that you're taking, right? Those are important follow-up questions to ask your patient. If they tell you that they're currently under the care of a physician, you want to find out what for, right? Do they have a chronic health issue that's going on? And determine the risk of that patient. What is their chance of having a medical emergency in your chair? Based on things like what's the nature of the condition that they have, what type of treatment have they had since the last time they saw you, and have they had any complications? Right? These types of things influence our appointment considerations. So the illnesses that your patient indicates on their health and of what's going on with their physician, there may be care modifications that need to be considered for a medically compromised patient because at the bottom line, the end of the day, what we're trying to do is stress reduction protocols, preventing a medical emergency, and figure out how we can best care for this patient and meet their needs without a medical emergency. It is important for us to ask any changes in their health within the last year, any hospitalizations. And I got to tell you guys, as dental hygienists, we have all been through the part where a patient tells us everything is fine and then the dentist comes in the room and the patient reveals something completely different. Do not be discouraged by this. This is just normal. I don't know why that happens to all of us, no matter how many questions we ask or how thorough we think we're being with the health history. It's just natural for some patients to think that the only person that they really need to tell the real stuff to is the doctor. Don't let that sway you from asking all the good questions, right? Identify an illness that may reflect their oral care, or note if there's a compromised condition, and where they're at in the healing process. If they do reveal to you that something has gone on, what is the illness? What were they hospitalized for? Why were they hospitalized? How long were they hospitalized? Any type of complications. And sometimes you will not get this information from the patient unless you ask, okay? Because you may have to do a modification to your care. They might have to get a medical consult, and the type of anesthetic that you choose to use with that patient may need to be altered. So when you ask a patient if they're taking any medications, make sure you ask if they're taking any medications or over-the-counter medications, non-prescribed medications, or herbal supplements. It's important for you to get an idea, like a big picture idea of the drugs, including over the counter, that this patient is taking. Ask the patients for the drugs, the medicine, the injections, the vitamins, the patches, the pills, right? All of these things, because their perception of what you mean when you say, are you taking any meds, may be different. And so one patient may tell you about a patch that they're wearing, and another one will not. One might tell you about the over-the-counter meds that they're taking, and another one will not. So how you ask those questions, how you show up as an interviewer, further questioning those findings, really determines the level of knowledge that you gain through doing this medical history. And there are contraindications or possible interactions with drugs administered during treatment. We're using local anesthesia, so you want to make sure that you relate those side effects from medications to the treatment that you're providing. Let me just give you an example. I take pseudoephedrine in the springtime to help with my allergies, and I have incredible dry mouth during that season. But when I go to the doctors, if someone asks me if I take any medications, I'm going to say no because I take it very PRN. I don't take pseudoephedrine on a routine basis. It's just when allergy season is at its highest. But that could increase my caries risk during that spring allergy season if I don't reveal that to my dental hygienist that I'm doing that. So I'm just giving you that as an example. And I'm actually a person who knows that I should be letting them know that type of thing. So allergies play an important role, right? When we think about allergies, we're looking for allergies associated with risk and exposure in the dental office. But honestly, we should be thinking about allergies, seasonal allergies, and their impact and their role in how we manage the caries risk and periodontal health of our patient. Now, there are types of bleeding disorders that we want to ask more questions about for our patient, like when did this condition occur? Are you seeking care from a physician right now? When was it diagnosed? And the type of disorder or medications as a result. Now, a physician's consult is always recommended when you don't know the proper information. Make sure that you know if that patient is taking an anticoagulant and if they've had lab tests for bleeding times, example, their INR. If that medication requires an INR, you want to make sure that they're falling within the correct range for proper treatment and safety, right? Oh my goodness. It's all about mitigating risk and being able to properly care for our patients adequately. I do want to talk about diabetes because diabetes is so big, right? We have to know about our diabetic patients. We have to be able to understand the risk associated with a diabetic patient. And so many of our patients are diabetic and they say that they're diabetic. So we know that they're at a higher risk for periodontal disease, for delayed healing, and for hypoglycemia during these long appointments. So you want to make sure that that patient's notes, those records indicate their risk of hypoglycemic emergencies. Do we have a controlled diabetic patient in our chair? Because those patients we can treat like a normal patient. But if they have undiagnosed diabetes, they may exhibit certain symptoms like excessive thirst or increased appetite, having to go to the bathroom frequently. But the questions that you ask when your patient circles diabetic, you should definitely find out what type of diabetic they are. Are they a type 1, type 2? When was their last visit to the doctor? What is their A1C number? That's going to tell us really how well controlled they are as far as healing and how they're managing, how they're going to show up when you actually start to do your assessment. So knowing their blood sugars for that particular day, finding out the last time that they ate, asking them if they experience low blood sugar episodes, like how well are they managing how they feel, right? So a controlled diabetic's A1C test is going to be 7% or lower. No treatment modifications are necessary for those patients, but we still want to ask those questions about when they ate last, what they ate, and what's their blood glucose level, because we want to monitor those. So our blood sugar goal is 130 or less while we're doing treatment for a patient. And if it's greater than 200, that treatment should be deferred and a medical referral should definitely be made. You want to make sure about the time of the appointment related to insulin therapy and their meal times. Prepare for emergencies with a sugar source. Frequent maintenance appointments as periodontal disease is accelerated, as we know, with staging and grading. And we're going to monitor their blood pressure as hypertension and cardiovascular disease are strongly associated with our diabetic patients. Those are some of the things that should be on your highlight reel when you have a patient who comes in and indicates that they are a diabetic. When your patient comes in and they say that they have hypertension, high blood pressure, right? The notes really, there's none if there's symptoms of other disease states, but you want to document that blood pressure, make sure you have a baseline blood pressure and that you're updating that blood pressure every single time and asking those further questions about the physician. When was the last time you saw your physician? What did they tell you? Have they changed any of your meds? Have they changed any of the dosages of your meds? Do you monitor your blood pressure at home frequently? You want to make sure that you're taking that patient's blood pressure every visit and you determine whether or not dental treatment can be provided. You're going to implement those stress reduction protocols. You're going to refer for a medical evaluation, especially if you get a blood pressure reading that's elevated and your patient hasn't recently seen their doctor, right? And you're going to defer treatment if it's a stage 4 hypertension situation. There are some side effects to a lot of these cardiovascular drugs that you have to be aware of, both with dosage modification for your anesthetics and xerostomia, postural hypertensive issues, gingival enlargement. All of these things are really important appointment considerations for those patients that present to you and actually, indicate these things on their medical history. So we also know our patients who circle that they have an autoimmune disorder or they're immunosuppressed, things like lupus or Crohn's or HIV or steroid therapy, or even chemotherapy, cancer medications, right? We know that these patients have a higher risk of infection, they have delayed healing, and possibly may have a need for pre-medication depending on what's actually going on with those patients. So make sure that you're further questioning. Have you had any recent infections? When was your last flare up? How are you managing your autoimmune issue? These are really important questions for you to ask a patient. There are follow up questions that are kind of blanket statements. When was the last time you saw the physician? How are you managing this? In your mind, you're always thinking about mitigating the risk. All right. These are the things that you have to be thinking about. There's a lot of patients who may circle anxiety or depression or a history of fainting is also incredibly common, right? Some of these medications induce xerostomia, increase caries risk, and also impact the patient's ability to withstand longer appointment times. The questions we would ask these patients are, do you experience dry mouth? Because sometimes as dental providers, we make these assumptions that our patients know about these side effects, but they may not. And they may not know about the dry mouth until it's extreme. So it's important to mention some of the symptoms that they may not be aware of and ask them if they notice themselves doing that. Like, do you notice that you're craving or doing frequent sips of water, or at night when you wake up, maybe your tongue is stuck to the roof of your mouth or you feel like your lips are dry? Those types of things really go a long way at helping your patient identify. Okay. And I have to tell you, so students will sometimes say, I don't want to feel or sound nosy. And here's the truth, guys. You are not being nosy, you're being a clinician. So use some of these phrases to really keep yourself comfortable. You can say to the patient, I ask this because it helps me keep you safe during treatment. Or thank you for sharing that. Can I just ask you a little more information about that to make sure that I understand? Or you could say, this helps me choose the safest care for you today. And I will tell you that your tone matters more than your words. Make sure that you have a level of curiosity. Okay. So there are moments when it's okay for you to pause and seek the guidance of your faculty. If something feels off, just stop. If you feel unsure, just stop. If the patient gives an unclear answer and you're not really sure how to connect the dots, I'm telling you guys, faculty would rather you pause and ask them rather than pushing through and risking the harm. So I have to tell you guys, sometimes the medical history is just like a box that we check so that we can get into patient care. But I promise you, you are not just checking boxes. You are actually protecting your patient. You're building clinical judgment. And every time you catch a red flag, you are becoming the hygienist that you are designed to be. All right. Take it one step at a time. I know I did not cover every condition, but I think you get the idea of further questioning your patient, looking at the details. If you find this information ahead of time on your patient, see if you can look up some of the information gathering because some of these softwares do a really nice job at connecting the diabetes with the condition and the modifications that you need to make. The more prepared you are when you see a patient in the clinic that has some of these conditions so that you can practice further questioning these findings, the more prepared you are, the more confident you're going to feel that you're treating this patient without the risk of a problem. And the other thing I will just say, don't avoid that patient who has a bunch of medications. Those patients actually need you more than ever. So it's a great learning opportunity. Yes, it takes a little bit more time, but I promise you, you will learn to be able to manage these patients a lot better under the guidance of your faculty if you just take on those patients. Do not shy away from the patient who has the complex medical history. If you guys found this episode helpful, share it with a classmate who's learning medical histories too. And always keep flossing, keep learning, and keep showing up for yourself, okay? I hope you guys have a great